Good afternoon, good morning, depending where you are based and located. I'm Dario from Next Pharma Summit, and welcome to this very interesting webinar, Content Disruption to Supercharge Your Omnichannel HCP Communications. Really pleased to welcome today Romika from Teva. Hi Romika, how are you?
I'm good. Thank you, Dario, for inviting me for the panel.
Mark Benthian from Viihealth. Hi Mark, how are you?
Hi everybody.
And Malik from Novartis. Hi Malik, how are you?
Hello there, you're very good. Thanks for inviting me.
Thank you very much. So before we start with an interesting discussion, I would like to pass the stage to Mark, who decided to set the stage and make us a very interesting introduction. So Mark, please, the stage is yours.
All right, super. Yeah, there's just a couple slides as we're thinking about all things related to digital, and if you move them forward, Dario. What we've been seeing is there's been obviously a lot of change of late. Everybody knows that the process of getting content through the system, I'll call it the system, is normally complex, is normally quite slow, and it really is, everybody would like to go faster. Now we're in an environment where digital materials need to be produced more quickly, and not only should they be produced, but everyone is already filling those various standard digital channels that we're all used to using. So how do you move forward? How do you both at the same time improve the user experience as well as the utility of the content and make sure that everybody is getting the right messages that they need to get while making the system faster, cheaper, and more reusable downstream, but also more personalized as well. So that's the challenge that's facing the industry today if we move forward, Dario. And what we've seen in speaking with our clients is that it really is now a digital content supply chain. It's no longer just I make content because this is the right key message. It's how do we assure that we are generating those key messages, but that we are able to reuse them as often as possible in as many different ways as possible across as many different markets as possible. How do we ensure the tie-ins with infrastructure and the various campaigns and marketing plans, and this notion of relevance to HCPs, as well as these key factors that drive the ability to generate content at scale that will be impactful. So this taking something that's evidence-based and original, but not just doing it as a one-off or as a straightforward, let's say, standard email that everybody on the planet is doing, but how can we make sure that it reaches the right intended audience quickly, easily, at a time when they're susceptible to be able to engage with it, and in different forms so that the messages can continue to be relevant, at the same time being both measurable and effectively everybody wants to drive that cost down over time in terms of the unit cost per use. So if we move forward, Dario, in terms of this overall structure, given that it is a supply chain, what are the ways that we can reuse, that we can move content across channel, that we can engage users? If everybody is receiving emails and receiving invitations for remote meetings, how do you raise the bar so that they can, the physicians that you're trying to reach, can understand the messages more clearly, that can deepen the relationships with either the digital channel or the representatives that are managing that relationship and bringing it forward? How can we take advantage of the capabilities of the various channels to actually invent new experiences and still maintain that same baseline of capability, of reuse, of enterprise nature of rollout of the core content? So I think those things are some of the key questions. And at the end of the day, it's really important in this mode and where we are today, we look beyond the research, evidence-driven content that physicians are looking for, and we move forward, Dario. Then we're really faced with how can they consume that content? What are the ways that, even though they are not consumers, but how can they, traditional consumers in buying a consumer product, how can those physicians be able to take advantage of material that's been produced into various different forms from an automation perspective, make it faster to get that material approved and rolled out and tied in with our infrastructure, and at the same time generate engagements with that material, with those key messages that go beyond the standard, that allows the companies to raise the bar with those different physicians that they're trying to reach. It's a key and core question. No longer can we look at it as just simply, I'm sending an email and receiving data, or I'm scaling that across multiple individual channels. We need to make sure that we can combine all of those aspects and really focus on raising the bar so that of the user experience, so that physicians can be part of this growing relationship going forward. So with that kind of baseline, I think it raises a number of questions about how to do this. And Dario, I'll turn it back to you for the next step.
Thank you, Mark. Let's move forward to the interactive discussion. We, of course, prepared some very interesting questions today among our panel group. Before we start, I would just like to mention that the audience is, of course, possible to ask questions. So if you have any kind of question, just type it in and we will try to respond during our session today. So let's start with the first question, which is quite obvious, I would say, and this is everyone does digital these days, right? But what to do next to make the difference, to make an impact? So I suggest maybe we can start with Romika. Romika, please, can you kind of give us the answer on this question?
Sure. Thanks, Dario. Well, everyone does digital these days, but what we sort of sometimes, because of the current need of the hour, we always have a push without having the ability to measure. But I think what we need to do is to see what channels are most effective when we are trying to talk about an omni-channel experience, and at which point of or what kind of content is effective in what channel is very crucial when we are doing this kind of engagement with our physicians or HCPs overall to get the right set of engagement. If you expect a deeper engagement in our target audience, then it's important for us to measure, I think, and that's the measuring is the key to having the strategic approach towards the omnichannel communication. Yeah.
Thank you, Romika.
So yeah. Welcome.
Malik?
So great question. I would say $1 million question. How do you make the difference and make your voice heard and beat the competition? No, I would say that in a way, it's about understanding what are your customer needs. Both our patients and HCPs, especially in those specific times that we are living in. And how do you then drive a better customer experience while still pushing the customer journey, still making them progress in your own customer journey, but still answering their needs. And I would say to do that, you need, as Romika was saying, you need to measure, you need to do some tests, you need to change the content, you need to be fast, to be agile. And for me, it's around being customer centric. If you want to make the difference, you need to be customer centric, and to be customer centric, you need to do a lot of things. But and that's I would say part of the discussion we are going to have in the coming minutes.
Thank you, Malik. Mark, how do you see that from perspective of a solution vendor?
Well, certainly if everybody is doing digital, then you have to be worried not about what your own messages are, but what that user is actually, that physician is actually receiving. So if they are receiving 50 different messages on a day or in a week, and they're all in the end look the same, they will gravitate to those things that they already have a relationship and deepen those. And it's really hard to raise the bar and keep gather their information in order to drive it forward. We've seen that it's very important for physicians to bring relevant content in context across the board. They need to be able to see, yes, this is valuable, but the packaging is such that I can consume it more quickly. If you look at some of the data from 10 years ago with physicians spending time online, they were generally spending approximately 1 hour a day online, according to all the research that was done. But it tended to be larger blocks of time. Now what we see is that the studies of physician time online, it's still looking for this kind of information. It's still approximately 1 hour, but into bite-sized chunks, much smaller chunks of time. Everybody is time slicing. So it's really important that on top of being not only customer sensitive, and that driving an overall customer experience over time, we need to ensure that the bite-sized chunks are delivered in such a way that they're very consumable. Consumable, in my mind, means something that's focused, that's personalized, that's relevant, that's delivered in a timely basis, that has an ease of manipulation that Malik was mentioning, where you can try things out that you haven't tried before, but do so cost effectively, so you don't spend time on A/B testing that takes so much of your budget that you can't actually move forward. So being able to do that kind of function quickly, easily, and we've seen that the advent of video, and if we think forward a little bit beyond just our current end of October 2020, we are going into what they call a macro cycle of 5G networks rolling out, which will mean more bandwidth, more capability, more mobile, more ability to consume materials and content. So how can we use visual media, video, other different mediated types to deliver really scientific and relevant material to those physicians that need to actually hear those messages? I think that's where we need to start moving. Bite-sized chunks that can be consumable, but also can have that media quality that physicians are seeking.
Thank you, Mark. Let's move forward to the next question, which is quite interesting because we definitely need to set some standards, right? And the question is related about what do you understand as disruptive content and how to achieve it, right? That's maybe the proper question for $1 million, right? Malik, maybe we can start with.
Yes, I can start with this one. So I would say, the content disruption and disruptive content, I see that, both internally and externally. Internally, for me, it's faster, it's better content, it's more impactful content. It's also something that is cost effective as well, that where we can have some easy turnover cross-channel. And this cross-channel aspect, I would say it's very important, to understand this whole customer journey and are you able to push consistent messaging across channels with still the same look and feel and the same experience for the customers. And of course, this would require, as Mark was saying, a better supply chain in terms of content, something more agile, something more dynamic. And at the end of the day, it's also something that could be more impactful for our customers. It could be more fun, but it could be also more interesting. And I'm thinking, of the high-end content that we can produce as pharma industries, including the webcast, including all the continuous medical education that we can provide to them to make sure that we answer specific needs, that we also, answer their part that want to be kind of entertained when we send them some content. It's not only, some of them would like to see some very scientific driven information, but some of them would like also to have information that is easy to digest and easy to look at for, as Mark was saying, a short period of time and then move to something else. And so in that, I would say that's part also of the disruption of the disruptive content we are building compared to the A4 paper that we were producing in font 12. Now we have to move to something different, something in the edge of Twitter, in the edge of Facebook, Instagram, TikTok, WeChat, etc. We need also to understand which type of content the doctors are attracted to and try to answer it with that.
Thank you. Mark?
So I think there's the content items themselves. If everything is driven by the key messages, and over the last 10 years, we've spent a lot, we've watched the industry really become enabled with what I call the railroad tracks. So very significant investment in channels, significant investment in data systems and data understanding, and an overall ability to execute on something that is digital. Now we're going to be faced with moving into what we think is the subsequent phase, which is really about that experience and service, being able to manipulate the messages that we've got still assure of a fast or as fast as possible regulatory approvals process, but being able to put it into the hands, more into the hands of the marketers and less into the hands of the making of the operational folks of making of individual content items. If you have the ability to do A/B testing easily, then you can find out much more quickly what is disruptive for your particular marketplace and focus on either segment-driven content that's special, knowing that 80% of your core materials are handled easily, that everybody will use across multiple markets. That's perfect. Allows you to spend the bulk of your time on finding the key elements to help drive the needle, support the brand, and make sure that the physicians are along for the ride. So we think that being able to move beyond core infrastructure of basic channels that are now functional is really important. And what's disruptive is engaging in this notion of cross-channel that Malik was mentioning, and also tying it with an ability to measure each of these different new content efforts.
Mark, Romika?
Yeah, so to add to that, I think what disruptive content overall for me means in our scenario especially is that the relevance and the timeliness and also the bite-sized bits that can help us, build that engagement. At the end, we want to have that personalized, approach to, the HCP needs, and somebody like Malik was mentioning may need very scientific, content as well as some very general content, which is probably more, for social sharing and, to build an engagement, etc. So I think overall, our key is to, build on that engagement, and the disruptive content means that we should have all these elements to put it together and then build our content strategy in an approach where we also bring in innovation, so that for example, it's not just about content, it's also about how we present it, not just about having something which is very static content. It could also mean about the various modes of engagement, like we could have e-learning, or we could have some more video-based interactive content as well, which we can work towards, and which we have also seen that it also helps adding value to your content. And at the end, it also means that we are creating certain needs which were unmet for the HCPs in terms of the value proposition, which sort of eventually, because they were not used to spending so much time, maybe an hour, and now we can time slice it, and then maybe we also have, different, options of engagement for the HCPs to consume. So I think it's also bringing in the variety and, in the content, which can cause, help us, build in the content strategy.
Romika? For sure, the biggest question is definitely how to differentiate, and I really heard a lot of times that customer experience might be the answer on that. So my question to you, and let's start with Mark, is modular content with proper customer experience something on what we should build on? Mark?
Well, I think certainly if the modular content, I think there may be a definition of that which is important to make clear. It needs to be something that is dynamic. There's a systemic approach that you can create content modules and be able to generate different materials, and as Malik mentioned, move them cross-channel or find new uses for them. But also, you may not know the modules up front. 5 years ago, if you were asking somebody about modular content, they would say, well, I've got 15 different components that go into every piece of content, and I can use one of those modules, and they're all predefined, and now I will replay them. It's not about that. It's about ensuring that you get those key message materials, those original agency and brand definitions, bring them into an environment where you are able to then manipulate. But the modules of content, as long as they have gone through the approvals process, should be dynamically generated. You should be able to define it at any moment in time. You don't need to make all of the modules up front. You need to make it as your marketing plans evolve and progress across the various channels. So I think that the notion of as long as your modular content is taken from that dynamic perspective, then you can really focus on, well, what is the customer experience that I'm trying to generate, and how am I trying to disrupt the marketplace that I see out there with my physician audience, who is, they're all receiving, as I mentioned, 50 messages of the same kind of material. So what is the way that I can go into that space and assure that my content is that much different? If I've got a dynamic modular base, then I should be able to imagine or test or try out different customer engagement experiences that help to drive it forward. We've seen from our perspective a good acceptance to video engagements, even when they're played properly. Not when it's animated GIFs in an email that are shaking and dancing and waving, but when it's proper, relevant content that is useful for the physician audience, that is tied to what they're doing, but is also delivered in a way that they can consume it easily. We've seen that video can be very disruptive, but that is something that can only be determined once you've got at least the base modules to begin with and start to work on the manipulation.
Thank you, Mark. Romika?
Yeah, so modular content does help in customer engagement, because then you can always have, bite-sized content, so which can be used in different channels, and you can innovate around them. At the same time, it's also, something that needs to be, measured in time to see how well it's applicable to, different market scenarios. And, we working from a regional perspective, it helps us to build a standard modular content block, which can be actually leveraged by different regions and markets. And, you can switch on and switch off different modular content pieces, as well as in when you need, based on certain market needs, and, having to have a central global sort of a modular base, which sort of also gives, so synergy towards the way we communicate to, different HCPs, but at the same time, keeping the value proposition or the value and the brand messaging constant across. And it also creates consistency, as well as, because we are, part of a, global, platform team. It also helps to, sort of give the markets the ability to leverage also from the, governance that we sort of set up, and, and also, apply it to the different channels and see the effectiveness of which modular content is working well in which each of the channels. So it also helps in the right channel mix optimization as well. Yeah.
Thank you. Malik? You're on mute.
Yeah.
Sorry about that. No, completely to build on Romika's points. I think the modular contents. First of all, we are implementing it. We don't have like 4 years of modular content after us. We are implementing it. But we really see, if we really want to be agile, if we really want to do this A/B testing, to measure the data, we need more agility. We need to be able to create some content, to have those bite-sized content and play around with it. And we need to be able to measure one group compared to the other, and we need to do that at fairly large scale. And in that sense, me too, working at regional level, this helps us, this approach, and working with Viihealth. It's also having the governance across all markets and being able to rationalize some of the content, even if there is some local content created that we find of very high quality, we can elevate it. And in that sense, for us, it's also having a consistent customer journey across markets, also, of course, with some difference, but at least having a common vision of the customer journey and the segmented messaging, and trying to understand, okay, how do we address it in a better way, and can we gather enough data to use it and to fuel our advanced analytic engine to really do then some cool things with K-mean clustering, random forest, and you name it. But to do that, you need to, if you want to do your proper A/B testing, you need to have enough data, and in that sense, and be agile. Then once you have the data, cool, but what do you do, and are you able to really be fast, really be quick? And unfortunately, you won't have more money. You won't have more money. It's not because you have the cool idea that they will give you more, that your business will give you more money to do it. So you need to do it in a smart way. And I think the modular content is one of the smart way to do it.
And just to follow up on that for a second, you mentioned the key message on the localization across multiple markets, and I think what we're seeing is modular content. The notion of dynamic, which is really important not to forget, is it's not the same expression within each of those individual markets. We've seen some great content that's been initiated from a regional initiated base that's then provided to the local market, and what they've done with it in order to then localize off of that same core has been really interesting. You know, they've changed, they've been able to have that baseline of materials there for whichever of the channels, and then they've changed into something else. It looks like something else, and very often we forget that just being having a module doesn't mean it's the same piece just played out over and over again. It's got the localization capabilities, then it's got the channel differentiation of how it's being deployed, it's got sequencing that might be different. And so being able to take advantage of that and make that easy to help those markets also do that work and become expressive then becomes interesting from a regional perspective to, as you say, Malik, lift it up when you find something interesting that has been proven within a certain number of markets, be able to then use that across potentially others and again change it again and keep that moving forward.
Absolutely, and also time to market is also something that we leverage from. So it builds on the agility as well. So if you have a baseline to work on, and a reference point for markets where we did not have it at all to start with as well. So that's also a good advantage, modular content.
That was quite helpful and interactive, I can say so. And actually, Malik set the stage for our next question, which is quite interesting and extremely important. And this is, of course, to speak about the major KPIs, how we actually measure content and overall communication success. Romika, can you please share your experience with that?
Absolutely. So the major KPIs to measure content, for example, we need to see how engaged our customers are. So we could also have, depending on what our strategy is like, do we have like a bottom-up approach or, sort of like a approach of soft engagement with a slow, like an opt-in and a consent capture? And are we seeing that, there is a step towards engagement where are we seeing the right amount of opt-ins and consent for getting the engagement going in terms of in the platform, say for example. And then in another perspective, if we see that we also, sort of want to create like, different effectiveness of the content, is some a reader spending enough time in a particular content to actually, finding it engaging enough? So are we even to, create those heat maps to see if the the reader is able to engage with us, and if we have a call to action, are they interested in getting into further on with the engagement, or they really want to self opt in for certain or subscribe to certain newsletters that we have, or keeping the engagement going further on. So even when we call for, say, for example, in a virtual congress, now that we've moved to more of the virtual congresses, are we going to, we have these, engagements right at the beginning, very beginning, and also till the end after the. So we want to keep the engagement going, and how can we measure these based on the KPIs? It's by the opt-ins or by the consents. Have they subscribed to the content that we want, or the newsletters that we want to keep them? So these are several points of engagement that we want to sort of measure and see the effectiveness. These are very high KPIs in terms of the leads that we get, in terms of the traffic and visitors that we are getting on the websites or any other channel, for example. Is this working, or is it also to see which channel mix is working? So if the web version is more effective, or the mobile version is more effective for an HCP, if they want to have more bite-sized contents in a different channel, and we see a lot of traffic in, say, mobile engagement, then should we change our strategic, have a strategic approach to say, giving some more bite size, which are mobile friendly, responsive, content. And not to make it too heavy in terms of having more large video formats in terms of engagement. So overall, we are in various stages of measurements in the KPI, for example. Like for the usual page visits and our optimization of the readers engagement towards any particular content, creating heat maps, and constant churn of these contents to see which is working at what point in the website or in which channel, for example. And all of these are, effective for us to, get the right mix in terms of the content strategy.
Thank you, Romika. Mark?
Yeah, somebody on our team kind of likened it to, from their perspective, it was the content item itself has to fight for its survival, meaning that it's about, what are you as a modular content item, who is using it, how many derivative versions have been created that are also being used, are they actually being used, are they then actually being seen with metrics in the channels, of which channels, of course, and obviously then the engagement within those channels. So if the content item itself is kind of an object or a person, if you will, a humanoid fighting for its survival, then it's about how fast is it created, how much can it generate with its children, what is its overall cost per use plan, and at some point it becomes very, very inexpensive. And then there's also the channel metrics of the clicks, the views, and the engagements that get layered on top of that. And if we can bring that information to the people, the brand teams, and to the global and regional and local brand teams, when they're thinking about what they want to do next from a strategic perspective, that's when the data is most relevant. So the data doesn't get stuck in a silo where the marketers that need to make the decision don't have access to some of the critical information that would allow them to say, well, in this environment with the heat map that Romika mentioned, it seems that not only are these users visiting and using this content, but there's certain key items here that are derivative of these key messages that we started with. Let's see if we can flush that out more and help to other markets to drive more usage of those particular content items. Those would be great conversations to have based upon that content survival.
Thank you. Malik? You're muted once again.
I didn't want to cut Mark. No. I was saying that I'm seeing three different levels. The first one is, the adoption or the retention of the channel. Is a doctor accepting the channel, and is he, coming on frequent basis? Is he not opting out even if we increase the frequency? Is he coming back to your webinar? Is he following something on LinkedIn, Twitter? And this adoption, the long-term adoption of the channel and the content is a good sign for me of are you using the right content? And of course, as Mark was saying, internally, seeing which content is used and localized from me as a region by the countries is also something. But externally, I would say there is an adoption of the channel by the HCP. The second one is as Romika was saying, of course you need to follow your your bread and butter, meaning your call to actions. You need to see which are the part that that you can see, and this you absolutely need to do this to the best of your possibilities. And I'm saying to the best of your possibilities because for the viewers that are here online, don't expect to have every channel with HCP level data, unless if it's the case for you, very good, congrats. But in most cases, it's not realistically. And our role as digital leads is to try to integrate as much as we can and deal with master data management to try to have one single view of the customers. It's not there yet, and of course we are in the process of working around that. As I was saying, as we want to build customer journey, we need to understand where do they stand and who is that, and compared to, I would say, hotel.com or those type of other industries, we it's harder for us to get customer level data. It's a bit harder for us, even if it's something we are working on. But all those actions are very important to measure to see at least if it's working or not. And when you got this HCP level data, when you are able to have this granularity of data, composite index are super important. And I'm having in mind, are you able to track in your CRM system the customer journey? Are you able to see if, with your advanced analytic machine, to see if there was a shift in the customer journey? And in that, knowing that you drive a bit your goal as marketing team to help the doctor to adopt new practices because you believe it's the best for the patient. And so are you able to track that, and are you able to see a shift in their behaviors? And of course, those are the hardest thing to get. But if you get the right data in place, and if you have this master data management, that's the end goal that you should be able to achieve.
Okay. My last question is related to the era of digital rep. I believe that we all agree that we don't speak anymore about the sales rep, med rep, or whatsoever. We speak today especially about the digital rep, and in that era, definitely content plays a crucial role, right? So my question to you is, how will not the new normal, but the next normal look like in the future, and a combination between the digital rep and the content itself? Who would like to start first?
Well, I could go first if you like. In this next normal that you're talking about, probably we would go for more of a hybrid approach. I wouldn't say that we would completely have a completely virtual form of engagement, but yes, more and more that shift is happening because of the times that we are in, and also because that also helps, and we have seen that in sudden acceleration of digital in all our work and projects has led to even the internal stakeholders understand the value and importance of digital in their own day-to-day work. So it's not just about having a fully digital engagement, but having a hybrid engagement, which also means that we have the sales reps, but how are we adding value to their lives as well, and all the all across the value chain. It's not just about and how that at the end helps the HCPs and the physicians to get added advantage, and are we able to free up some time from the reps to actually for them to focus more on the client engagement and what they would want, because they don't have to go for a face-to-face visit, and they can have a good remote virtual engagement, which is probably increasingly being more acceptable and effective. And also time of engagement has increased, and the effectiveness of the reach has also become the norm. So I think the next normal for us is, as we move towards it, I think it's going to be more of hybrid in terms of the way we have worked so far, physical and the virtual channels, because I don't see complete shift, immediate shift, because of course we have been in a time when the physicians or the HCPs were more in, engaging with the face-to-face interactions, and slowly we are moving, and we are seeing that the engagement and the share of voice is increasing even from the virtual engagements that we are having. So, like I also mentioned previously, the value proposition for the HCPs, what we are offering, is also slowly moving, and they are also accepting it. It's not like, of course we are being pushed to accelerate, but at the same time, they are also able to accept it. It's not just about, something about pushing digital onto, people and HCPs and the end users. But yes, over time, I think we would also get, towards more data enriched, of course, because we don't have that kind of data like Malik was mentioning. But with more and more virtual engagements, our data and the ability for us to measure what is working and what is not, and also to understand their needs, HCP needs, will get more, visible, and we'll be able to socialize it with different, key stakeholders, whether it's the brands or whether it's the reps or whether it's market leads, to make it more effective, and yeah, at the end, help in building that 360 customer approach, so that we have all the content and the service elements together to sort of give them the right sort of engagement, because a lot of it is going it's not, it's in the dark, because we are not able to measure. So what we are not able to measure, we can't even improve. So now with time, I guess, our ability to measure and be more aware of what's working and what's not, and will help us to engage better and better with our end users and HCPs.
Thank you, Romika, for the interesting insights. Before we move forward, once again, I encourage our audience to ask questions if there are any questions for our speaker group. Mark, how do you see this next normal in terms of content and the digital rep?
Well, I think we're, so now, as you've defined it, digital rep, so we're now setting that baseline, but we're really just starting to scratch the surface of how we can ensure that those relationship managers, if you will, are able to become part of the digital sphere, not just relegated to, let's say, the live conversation, which is a very important part, but they can certainly improve their capabilities to be able to be live digital. That's great. But how can they be also in effect, a modular piece of content? How can they be part of the virtual conversation in a compliant, dynamic manner that also appeals to physicians and helps to drive that relationship further? We are particularly think that the reps are actually well positioned because of the relationship to do more than we've given them the tools to do today. And can actually move forward in certain cases where they will be able to become part of the digital only channels, not only the remote meetings and the live meetings, but also, or just triggering an email that everybody sees as the same kind of email. We think that they can be much more part of those messages that are delivered asynchronously, where reps can play upon that relationship and deliver the right kind of message to their physician audience that they know so intimately, and to do that at a scale basis and quite confidently.
Malik?
I'm not on mute this time. Good. To build on both points from Mark and Romika, I would say that the reps are not over. They've been owning the relationship between the doctors and the company for the past 50 years, and of course, everything is changing, and all our usage of information and relationship is different now. Even when you buy something, you buy it online or etc. But you still like this personalized. For important things, you still like to have someone to talk to. And I would say, this high value customer experience is also where our field force can play a big role. And understanding also how do we continue to coordinate this customer experience, just by discussing, beyond the data, all this informal discussion, and just being there, understanding the environment of specific doctors in specific hospitals will make a big difference in, customizing as well, fine tuning, because in all advanced analytic projects, sometimes you still need some manual labor. And I would say that for us, it's also the role of our field force to understand the subtlety of the relationship. We were discussing about virtual reps. I'm not 100% sure, and I've been selling it for years as well, but I'm not 100% sure that remote calls will replace face-to-face call. I don't know to which extent, but to the best of our knowledge, based on the data that we got, and that was the best stress test we ever had, in the past years. But many of the calls were phone calls. Many of the calls, sometimes the rep prefer to give a phone call, also because, of course, there is a change management piece to do, and we need to help them to acquire the skill of doing the remote call. But still, sometimes just a phone call is important and is enough for the doctor. And based on some data we gathered on market research, it's still also very accepted as a channel, more than just doing a proper long call with slides, etc. So I still see that the reps has this important element to play. to continue on this discussion, I see them as a good bridge, between the non-personal promotion and the personal promotion. And how can we continue to help to also build technology to continue to build properly this bridge between, let's say, your HCP portal, your bots, and someone physical that you can call if you have a specific question. You went online, you went to your bot, and then if you want to talk to someone, you have someone to talk to because you have a specific patient with a specific thing on his disease. And I think there is some futuristic thing that we could do as well. We are not doing yet, but as Mark was saying, are we able to involve more the rep in the content creation? Are we able to industrialize the process of still doing medical legal review? Still not letting them create their own method and push it, but can we find some less monolithic way of creating content where marketing create it and then push it and then push it into the sales meeting for everyone to say it during the face-to-face call? Are we able to create two-way communication in a structural way, and are we able to do that in an agile way where we would be able to ask them to help us in the A/B testing? And I would say that's also a part where I see field force as a critical element for them as well, to focus on the high value customers, the high value customer experience creation, more than the high value customers, more than on the high value customer experience creation. And in that, I think owning the relationship and being the face of the relationship is super important.
Thank you all. Last question. Do you have some good examples for A/B testing? Can you share those with us? Who would like to start first? Maybe Mark.
Well, sure. Just some simple metrics. So we've played with some of the media. So if we play with it, everyone's receiving email or rep-triggered email or campaign emails. And if we focus on the disruption component of video, putting it into an email, but doing it properly, what we would consider to be properly, where you can lever the email to have the appropriate preview of that content in the email. What we've been able to see is that alone, which doesn't change the content itself, doesn't change the core of the message, but makes the email dynamic to anybody that has the standard mobile browser on either Android or iOS. That's a functional change, but it generates twice the amount. So far, what we've seen is generates twice the amount of click-through and 3 times the amount of time of engagement with that particular channel. Those are interesting numbers. Now, it's in the application of its relevant content. It is based upon modular content, but it's presented that content in a slightly different way, and made it easier for those physicians to consume, which obviously, given that it is slightly differentiated and the video effectively plays upon message open, not necessarily just on message click, or at least the preview of the video does, you're able to deliver your key messages quite easily in that format in a nice bite-sized chunk. And we've seen that physicians are drawn to the newness of that capability when it's relevant content, good scientific value, et cetera, et cetera, et cetera. And they're able to then participate that much more. So that's an interesting metric, which is about we think the digital reps can also be part of in the future. They could be connected to that in some way, whether it's through an audio intro or a video intro, as Malik was mentioning. But those are some interesting metrics that can be used from an A/B testing perspective. Standard message on one side, something a little bit supercharged on the other. What do you see? How much of the messages are going through? How many engagements are there? And as Romika mentioned, what do those engagements lead to? What are the follow-up actions? What are the call to actions? So that ultimately the physician is starting to favor and be interested in opening your messages as opposed to somebody else's.
Thank you, Mark. Romika, Malik?
Yeah. I think I would agree with the approach that Mark just mentioned. It's about trying to play with 2 different sets of content. One could be the very disruptive in nature, and one could be the usual plain-sized, static content, and whether it's working, whether it's the dynamic ones which are more acceptable. And it could also differ from, region to region, because for us, I think digital maturity in each of the markets in terms of the HCP digital maturity or overall digital maturity in the markets is also very important for us to know whether it's the static content or a dynamic content which can work well. And I think this sort of gives a nice, approach to understand whether, what is exactly, it's not always that dynamic content would work in, certain not very digitally mature, customer base or end user base. So I think that is an approach that is a wise one to take before we start planning certain content strategies.
So I will try to give some concrete examples and how we started. We started with Marketing Cloud, Salesforce Marketing Cloud, also because the A/B testing is integrated. Doing this with your reps, possible, tough to do. Possible, tough to do. With Marketing Cloud, it's integrated. You can create your sequence of message and sequence of email with specific actions depending on token that you can take from your CRM system or from your database. And so what we did, the first, as I was saying, we're using this segmented messaging, depending on the typology of the doctor compared to a specific drug. And so we tried different sequence of email to try to see on specific segment of customers what was the best sequence to convert them into buying in what the overall journey. And so we tried different sequence to see if one was better to another for specific segment of customers. And this is fairly easy to do. This is something you can easily test on the platform and have concrete metrics on call to action and opening rate. A second very simple one that you could fairly easily do as well is the sent date and hour of sending the email. And that's something also you can customize within the platform, where you could have some quite big difference. And also this will help you to create a new segmentation out of that. You can have the early Monday openers, and you can have the late Sunday as well. And so just based on that would help you to adjust and create some new fields that would help you to be relevant at the right moment. The right moment is quite important, and that's something you can start playing with and add this additional layer of data. Last but not least, you can also adjust the frequency based on your call to action and open rate. All customers don't have the same productive frequency. And in Marketing Cloud, you have some tools with the Einstein Analytic to help you to try to adjust that. Basically, you can see which one would be better with, I don't know, 1 email per month or 6 email per month. And before sending it, you don't know what is the optimal frequency. So you have some tools to help you to play with that and to try to measure your channel adoption, as I was saying before. And those are things that if you want to start playing with A/B testing, it's probably a good first step.
Thank you very much. With that thought, I would like to finish our today's webinar. Thank you, Mark, Romika, and Malik. It was very insightful, very interesting. The webinar will be published on our YouTube channel, so you can watch it, of course, anytime. Thank you very much once again, and wish a nice weekend to everyone who listened and joined today. Take care.
Thanks, everyone. Bye.
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 Romika, bye, Mark. Bye.
Bye.